can't sleep, you're in good company. And we've got an awesome guest today that's going to help with some answers as to why we can't sleep and what we can do about it. Our guest today is naturopathic doctor, Dr. Leigha Saunders, and she's got some great information for us. Before we dive in, let's give a shout out to Shannon Dunn. Thanks for being a listener. Now let's dive in.
Welcome to the Girls Talk Healthy Aging podcast, where we dive deep into pressing health and fitness issues facing aging women. I'm Alli Kerr.
And I'm Shawna Kaminski. And together we'll bring candid conversations, expert advice, and personal stories that will inspire and empower you on your own wellness journey.
Well, Leigha, we are very excited to have you because I think without exception, everyone can benefit from more and better quality sleep. So you're going to just be a lifesaver for so many women in particular.
Thanks for having me. I'm excited to be here.
Well, let's just dive in. Why can't we sleep?
Why can't we sleep? It's such a great question. So when we look at what's happening across the lifespan for women, we are about twice as likely compared to men to experience a sleep disturbance over the course of our lifetime. And so we see that before puberty, when there's no hormone differences between boys and girls, our sleep patterns are the same. And as we progress through puberty and our reproductive years, and if you experience pregnancy and then postpartum, perimenopause, menopause, and beyond, we see very specific sleep changes that happen according to what reproductive stages you're in. So if you're hanging out with us over on YouTube, I'm going to show a picture. I'm going to pull up this slide because when I found this graph, and for those of you who are listening and not seeing the visual, it looks very much like the evolution of man when we started as a primate and then evolved into the human or Homo sapiens as we know ourselves to be now. This graph shows a little girl growing up through to become a wise old woman. And we can see like there are very real sleep changes that happen as our hormones change. And that's not the only thing, but it's a big driving factor. And I think why we're having this conversation today. But the keynote is, as you can see in perimenopause and beyond, as our hormones decline, there are two key things that happen to our sleep. One, you see an increase in this wake after sleep onset, the red part of the graph here. You can see how much that increases as we get older. That's the amount of time we spend awake after we've first fallen asleep. So for my patient population, and I'm sure maybe for both of you and the women who you work with, women will say like, I fall asleep fine, right? Like out of pure exhaustion, I hit the pillow, I fall asleep. That's not the problem. I wake up every night. And often women are like at 3:17, it's like the exact same time on the clock. And I can't get back to sleep because as our hormones change in perimenopause, let's take this as an example, we're in the midst of so much, right? Our kids are getting older and more independent. Our parents are getting older but more dependent. We might be experiencing health challenges and concerns for the first time. We might also be at the peak of our career. We might also be navigating relationship challenges because we've now been with our partner for 30 years and that's getting to feel a little bit old and not so exciting in the midst of all of these other stressors that are happening, right? So when we have more stress and when we see anxiety and cortisol elevations and fluctuations play a role, we see that wake after sleep onset increase. So again, you're going to wake up at night and struggle to get back to sleep. And then as a result, this blue part of the graph there shows you your total sleep time, which goes down as we get older. So it's valid. It's real. It's not in your head. There's nothing wrong with you. It's not because you're broken. It's a real implication of what happens as we get older. And if I can share one more graph before we come back to like, why are we not sleeping?
And while you're sharing that graph, I have want to fill in a little bit because I know that we're making an assumption that I know is people don't know, and that is about perimenopause versus menopause. Because a lot of clients don't, a lot of listeners, well, if they're listening to Girls Talk Healthy Aging on the regular, they do know the difference. But if they're just now joining us, a lot of people don't realize how big of a span of time that is or when that starts. So if we can just
backtrack,
help catch everybody up on that before we move on.
Sure. Yep. So if you're paying attention to your menstrual cycle, so for those of you who are menstruating, in your reproductive years, in a healthy menstrual cycle, it's regular. It may shift a little bit here and there, and a regular cycle means it's coming somewhere between 25 and 35 days. Ideally, you're bleeding for less than 5 days, although up to 7 is considered normal. We could have a whole other podcast on what heavy bleeding is, but ideally, you're using less than 16 menstrual products per cycle, and any bleeding that requires more products than that, or if you're bleeding for longer than 7 days, raises cause for concern. So, assuming we're having somewhat of a regular menstrual cycle, then that would put us into our reproductive years. As we reach the later stage of our reproductive years, there will be really subtle changes to our menstrual cycle regularity. And so, for women who have had a very regular 28-day cycle, they might start noticing that now their cycle is coming at day 25 for the first time. Again, it's not a concern. It's just something that you notice if you're really in tune. And I would say many women don't even notice that if they're not tracking, or of course, if they're on something like the birth control pill, or if they have an IUD and their cycle has changed because of those things. We reach perimenopause officially. The easiest way to diagnose it is when our menstrual cycle changes by more than 7 days in either direction. So let's say you were that 28-day like clockwork cycle. Now your cycle is coming every 20 or 21 days, and then maybe it swings and now it's on day 36 or 40 and you get your period. So when we see that more than 7 days difference, again, either earlier or later, that's the easiest way for us to say, yes, you're in perimenopause. However, your cycle may not be changing that much, so it may not be more than 7 days difference, but you can still be feeling the effects of the hormone changes that are happening beneath the surface. So this could show up as sleep change. We're now recognizing, and sleep is listed as a cardinal symptom of perimenopause and menopause. So we're recognizing it as a thing that changes in relation to those hormone changes. It might be the first thing that you notice. You could be an incredible sleeper, not have any issues. All of a sudden, you're like, why am I waking up? This is not like me. Or you might notice energy changes, mood changes, new or worsening of PMS symptoms, like breast tenderness is a big one that can happen in perimenopause, brain fog. So lots of these things come because of the hormone changes that we're experiencing. And then over time, as our cycles are closer together at first, but then our ovulatory capacity runs out. So we're born with all of our eggs as women. So once we reach almost no more eggs, our cycles are going to be very, very far apart. So you're then in a late stage perimenopause when your cycles are coming every 60 days or later. That part, when you're getting your period every 2 months or further apart, is more predictable in duration. That usually lasts for 1 to 3 years. So if you're in that, you're on the home stretch. When you're in that wild roller coaster ride of your hormones going, like your cycle coming on day 20, and then 15 days later you get a period, and then you go to, you're still in the early stages. And that's really variable. And on average, I think it lasts somewhere between like 3 to 6 years. It can last up to 10, the whole transition. So we're talking a decade here of things that can impact us and how we're feeling and how we're sleeping. And then menopause is at one point in time where we've now gone 12 months without a menstrual period. And after that, we enter into the post-menopausal period. We just never know we're in menopause until we've been there for a year, because we're looking back, right? And saying it's now been 12 months.
Yeah, it is important to track. And then there's some people that can't because they've had a hysterectomy or other issues. And so, and it is just such a crazy time because, as you explained, there's so many other things going on. It's like, is my sleep changed because I have a teenager that's out late? So I'm worried about that person. Like, so there's just so many variables.
Mm-hmm. Yeah. In the midst of hormone changes. And what
Correct.
we're really starting to see and understand about these hormone changes is that they have a very real impact on our brain and our nervous system. And so what I hear women say all the time is like, I used to be able to handle this or tolerate this or be able to roll with this more. And now I just can't keep up in the same way. And we see that it has a very real impact on our ability to respond to and manage stress. So I call it as like an opportunity for us to, it's your midlife wake up call in many ways, to be curious with yourself and compassion and say like, okay, maybe what I've been doing so far isn't actually working for me. And maybe now my body needs something different.
Correct.
And learning as women to maybe take that as that, okay, let me put more priority on something like sleep.
100%. Yeah.
All right. You had another slide that
I'm
you
going to
wanted to
show you
share
this
with
other
us,
graph.
but I thought that was,
Yes.
thank you for that, Alli. That was a great question to sum up.
This graph shows you the frequency of sleep disturbances according to the time of final menstrual period. So if you're not watching us but are listening, imagine a triangle, right? You can see this graph, there's like a dramatic increase. The apex or the point of the triangle lines up with on the oh my gosh, I'm not gonna do X and Y because that I'm gonna mess that up. The horizontal axis is going to be our time, right? So according to time since last menstrual period or relative to that. And then on the vertical axis, we've got like how frequent or how, what's the frequency of reported sleep disturbances. So the higher we see that graph go up, the more sleep disturbances are being reported. So if we draw that line here where we see the final menstrual period, and each of these bars represents 2 years relative to the final menstrual period. So this is the 2 years prior to that final menstrual period, and this is the 2 years after the final menstrual period. You can see it's a massive jump and increase in the frequency of sleep disturbances that are reported by women. So we see like it's pretty steady through reproductive years. It starts to like kind of go up in perimenopause, and then it's like boom in that 2 years before your last period, which you never know it is until it's happened. And then even more so after the 2 years after your final menstrual period, like sleep disturbances and issues just skyrocket. And then it takes us about after those first 2 years. So now we're looking at year 3, 4, 5, 6, 7, 8 years to come back down to baseline.
The good news is that there's more sleep ahead.
Yes, the good news is even if we do nothing, sleep gets better, but certainly there's so much we can do to support our sleep in this transition and these phases of life.
So since it is inevitable from a biological standpoint as well as environmental standpoint, we are most likely to have some sleep challenges. What are we going to do about it? That's why we're here.
Yeah,
give us some
absolutely.
hope, Leigha.
Like, yes, it's not all lost. So it's interesting because I have a podcast as well, and I was interviewing a guest, and she has a large membership of menopausal women. And she recently did a survey on sleep and asked to know more because most of her members complain about sleep issues. And she asked them, like, what is getting in your way of fixing your sleep and addressing your sleep issues? And the most of the respondents said, getting over the fact that I can't deal with this on my own. So what does it tell us? It tells us how much we grin and bear it as women, how much we minimize our symptoms, how much we think this is just normal. When I was pregnant for the first time, the number of people who said to me like, oh, enjoy your sleep now. Cause like we just create such a narrative around like, you're a woman, you're a mom, you're in perimenopause, you're 40, you're now in menopause. It's just what happens. We don't sleep. So we normalize that, we minimize it, and then we think we have to deal with it on our own. So I would say step number 1 is like, if you've been trying to do that and aren't yet having success, ask yourself how that's going, and let's ask for help. And it's probably going to have to go beyond what we call sleep hygiene. So sleep hygiene is like avoid screen times for an hour or two before bed. Don't have caffeine in the afternoon or evening. Sleep in a cool, dark, quiet room. Like, you've probably been there, done that. Now, because of these very real hormone changes and everything else we described are happening, we have to look at those.
Yeah.
So a couple key pieces there. One is the hormone aspect. So we're losing hormones. We can't stop that. We won't prevent it. We're not going to delay that from happening, but we can replace them, right? And we can put hormones back in. And hormone therapy has been shown to be very effective at protecting against and addressing sleep disturbances and sleep loss in perimenopause and menopause. We see that's largely related, but not only related to hot flashes, night sweat. So collectively, we call that vasomotor symptoms. So what that means is in women who have vasomotor symptoms, they are also very likely to have sleep disturbances because the hot flashes or night sweats are waking them up. But we see even in women who aren't having those vasomotor symptoms, they will still experience sleep disturbances. So we can use either or both. Progesterone, oral micronized progesterone is the best form to help with sleep. If not, I would say the only form. We don't see the same beneficial impacts on sleep from the synthetic progestins. So oral micronized progesterone would be, the brand name would be Prometrium. Many people are familiar with that. So we can use that on its own. It's been shown and studied to effectively treat vasomotor symptoms. So again, hot flashes, night sweats, as well as sleep disturbances. The benefit is that it's a natural sleep. So when we take progesterone by mouth, it gets metabolized by the liver. It creates these byproducts that act on our GABA receptors. GABA receptors are those same receptors that alcohol and benzodiazepines, so like your Ativan, lorazepam, those are what those agents act on to cause us to feel relaxed, right? But we don't want the side effects that come with those other agents. And progesterone doesn't carry that same addictive quality or withdrawal effect or anything like that. It's a natural sedation. So we feel sleepy, we feel tired, we can get to sleep easier, we can stay asleep, we can get into a deeper sleep. And because of how it acts on GABA, it can have a very beneficial impact on our mood and provide some anxiolytic or reducing anxiety effects. And when you're sleeping better, you just have a better mood.
Yeah.
Right?
Life is better.
Yeah. So that really counts for addressing. And progesterone is, again, very well tolerated, safe. It can be used, I would argue, in almost any woman, even in women who've had a history of cancer. So, of course, we always want to individualize that assessment and have that one-on-one conversation. But what we see, and this is documented in the literature, the reason that more women aren't using progesterone is because doctors don't know enough about it. Doctors don't know that we can use it on its own, that it's safe. The risk profiles don't apply the same way to oral micronized progesterone as progestins and certainly as estrogen. So we can use it, oral progesterone on its own, and or we can combine it with estrogen. You can use estrogen on its own if you've had a hysterectomy, so if your uterus has been removed, or if you have something like a hormone releasing IUD, like the Mirena IUD. So those will provide endometrial protection. What we see is if we combine both. So if you're having trouble sleeping and using hormone therapy as a strategy to address that, if we use both estrogen and progesterone, you'll get added benefits. They're more effective together than either is on their own.
Great. Yeah. And then in my generation, you know, the WHI study, like I've stayed awake for those 10 years because this was not something that was actually, that's not true. I haven't struggled too much with sleep, but I think that is one of the issues that many people are, you know, we're all fighting, that the misinformation that came out of that study, and people like yourself, and thank goodness menopause is having a moment, that some of that data is the tides are turning on that. So thank goodness for that. So hormone therapy, more of an option for many than ever before.
Yeah.
What else?
I was going to say, what about, well, I wanted to just ask about this because I know some of my clients, they have passed that point of
Sure.
the window where they can take hormones. So I think that kind of goes to also what else for them? Because I also have clients that are past the point, they're in post-menopause, but they're still having sleep issues. And they may feel like, okay, I can't do hormones now. I've missed that.
Yeah, no, it's very true. So that's where I would look at nervous system regulation. Like, what are we doing to support your nervous system? Because sleep is the ultimate gauge of your nervous system. If we are stressed and if we have higher levels of cortisol, we cannot sleep. So the only other time a species on this earth delays their bedtime on purpose is when animals are facing periods of famine and need to stay awake later and longer to find food. And so we, for as privileged as we are, don't have that famine in our lives, yet we're cutting our sleep short or not getting adequate sleep for whatever reason. So this puts a massive impact on our nervous system, on our stress levels, along with or in addition to the other things that we're experiencing that I previously mentioned that are contributing to stress. And what are we doing more than ever before? We're certainly not moving, right? We're sitting more than ever before. Our lifestyles have become more sedentary, even though we're more digitally connected than ever before. In many cases, we're more socially isolated. Our food quality is highly questionable unless we are consciously curating a healthy diet that's giving us adequate protein and fiber. And so when we look at all those pieces, it's a really important aspect to look at, because if you're stressed, and some people are more sensitive to this than other, they'll have what we call a higher sleep reactivity, but that is often one of the first things to go, right? I'm feeling anxious. It's hard to calm my mind down. I'm awake. I call it the monkey mind, like you're swinging from branch to branch or thought to thought. So what do we need to do to help you get into a more relaxed state? How can we address what's going through your mind during the night? How can we help you feel more calm? So that's an endless list of things that we can do. But to give you one example, there's a really cute study that they did, and they called it "Don't Worry, Be Constructive." And they asked participants who all met the criteria for insomnia and to purposely set aside time in their day, ideally well in advance of bedtime, to actively think about what they would be most likely to worry about if they were to wake up that night and lie in bed and ruminate. And the participants gave themselves time to think about what would be on their mind, and arguably most importantly, then had to come up with one next action step that moved them towards resolving the worry or concern. So our brain is just always looking for solutions and to close the story loop. So if you've got a stressful situation in your life right now, you might want it to all to be resolved, but if we think about it, that's not going to happen in the next minute or hour or day or week. But we can focus on what you have control over next, right? Do you need to call someone? Do you need to make an appointment? Do you need to send an email? Do you have to have a hard conversation? Do you need to change something in your calendar? So there's so many little things that we can bring it down to, but we get caught in this endless loop of thoughts. So this activity forces you to think about what's on your mind and then identify the next action step that you are already or are going to take. And then if you wake up that night, you bring your thoughts back to that locus of control. You bring your thought back to like, this is what I can do about this next. I got this. So the participants were asked to do this every day, and they didn't even do it every day. They just did it as they felt they needed to. And the improvement in their sleep was absolutely incredible. It was a significant improvement in time taken to fall asleep, a significant improvement in the time spent awake at night, an improvement in sleep quality and quantity. So it just shows how in an age where we can be like so quick to distract ourselves in the day, right? We can be so overworked and over busy and go, go, go. If we just take some time, and it might be oversimplifying it, but if we take some time and focus on that solution, even better if you can do that while you're like going for a walk in nature. So you're moving your body and burning off the effects of cortisol and adrenaline. These are the things that help us feel better and sleep better.
And I can hear, go ahead, Shawna.
I was going to say, I think that highlights how simple solutions can be, but they do require some intention and effort. And many people will just go for the over-the-counter, the melatonin, the NyQuil. Like, tell us why
Sure.
we should maybe go for the walk
Yeah.
instead of reach for
Yeah.
melatonin.
Sure. Alli, did you want to add anything to that?
So along the same lines, I can just I hear some in myself and some of my clients thinking I think oftentimes don't believe that we have control over our mood, over our stress. We just don't believe that that's possible. And so I think that that is why we do some of the other things that we do, but just recognizing that we actually can. And I don't know how we get there, but I think that's something I'm still working on personally and realizing and recognizing, and it does make such a difference once you believe that you do have the power to control those things versus like, well, it was just a tough day. Well, all these things happened to me and I have no control. And I think a lot of folks are in that boat. We just feel out of control about controlling our emotions, our mood, our stress.
So we pop a pill.
Absolutely. Yeah, so we pop pills, totally. And so I think it's a really important highlight and to recognize and to call ourselves out. And it is sometimes a hard question and a hard conversation to have with ourselves, but asking, like, am I sitting in what we call victim consciousness? Am I sitting and saying everything is happening to me versus saying, why might this be happening for me? Like, in the midst of my life, as things feel like they're falling apart, what's the lesson here? What's the learning opportunity? And that can be really hard. Like, I've been in those dark, deep moments where you're in the despairs of depression or burnout and thinking, like, this is not okay. I am not okay. What is the good of this? But when you're on the other side, you can see it, right? You can see, like, oh, now I know I had to go through that and learn that lesson. And so if you're willing to just take one step in the direction of, like, I'm going to focus on what I have control over, because everybody has control over what time they get up in the morning, what food they put in their mouth, how much they caffeinate, how much alcohol they consume, the thoughts you think, the relationships you have, the job that you're in. You can think that you don't have control, or you can think that this isn't a choice, but you saying you don't have a choice is making a choice to not have a choice.
Yeah.
And that's hard to sit with in truth. So it's way easier to scroll on Instagram or TikTok or down the bottle of wine, because it can be very confronting if we have those types of conversations. So it's not about blaming, but about stepping into your power and saying, like, okay, I got to do something here. And here's where I can start. And the rest you might need help with. That was my point of the beginning, when women are saying, like, I need to get over the fact that I can't deal this with my own, because how much do we grin and bear? So then it's like, okay, I know I can go for a walk, but I don't know how to fuel my body properly. When all this talk about protein, what's protein? How much do I need? Go work with a nutritionist or a naturopathic doctor or a functional medicine provider or like, you can get and access the resources. Yes. All the way from free through, very high level care. But it's about stepping into that and saying, like, I'm worth this. Actually, I'm worth this time and energy. And this is a sign of, maybe you not sleeping. I always say, it's like, if it's the only time you're undistracted in a day, when your head is on the pillow, then of course all these thoughts and feelings and emotions are going to come through. It's a bottleneck effect. And
it can be a bit, I don't know if offensive is the word, but when someone is experiencing all those emotions, lack of sleep, and everything is piled on them, it can be confronting to say you're in control. It's the truth.
Yeah.
But I think that we need to say it in a gentle way, to say, okay, you don't have to change everything, but even just making some small changes, you will notice over time will garner better sleep or better life balance. But I know that when I've talked to women that are in the thick of it, they feel very overwhelmed and hopeless. And so that's why the bottle of wine, the melatonin, the over-the-counter, like, it's just so appealing because they're just feeling so lost and hopeless
And
about
women,
it.
I feel like, Shawna, that don't feel, a lot of women, I see that one of the saddest things is we don't feel worthy to invest in ourselves, to prioritize ourselves. And that, but yet we don't realize spending money on that wine or the, all those things, but yet we'll fail to prioritize the cost of hiring someone that could help us, coach us through whatever we're going through. That's not, we just can't wrap our minds around.
Oh, I meant the cost of not investing.
Right.
People don't look at the cost of not sleeping and having this runaway life that they don't feel in control of. And then they just look at the cost of what a doctor or a coach might be to help them kind of tangle this ball of twine that they just feel so wrapped up in.
I love the conversation of the risk of doing nothing, actually, because we don't have it enough. We don't have it enough in medicine, and we don't have it enough in our life because we focus so much on what is the risk of me taking this or doing this or investing in this or whatnot. What is the risk of not doing anything? What is the risk of if we do not change? Because those risks are also very real. And what I think I hear you saying is like, yes, absolutely. When we're in the thick of it, we can feel like we don't have control and we don't know our way out. So then it's about making a conscious decision. If we're going to go for the wine or the NyQuil or the sleeping medication or whatnot, all of those things can be, maybe not the wine, but all of these things that we will sometimes reach for, they can be tools. And so how I will encourage my patients to use them and say, let's use this as a bridging strategy. Okay. So take a sleep aid of any kind. It's like, do we want you to be on them long term? Of course not. Is it the thing that's helping you sleep right now? Yes. Great, because you need to sleep. So let's keep you on this while we talk about your protein intake, your fiber intake, your stress management, your movement, your inflammation, your right? So it gives us, those things can be tools that give us the capacity to do the other things that then lead us into building that foundation so we no longer need the sleeping medication long term.
Yeah, I was just going to say thank you for pointing that out, because I didn't mean to demonize it, because it definitely is the bridge, the tool. Thank you so much for that. I don't want people to just turn it off and be like, well, I can't do without. But then use it, but then get some help to not use it.
Yeah, because melatonin, for example, really only helps us fall asleep. If you don't have a problem falling asleep, if you're not jet lagged, if you're not working shift work, it's probably not going to do anything for you. Over-the-counter sleeping medications can do a great job at helping you sleep, but long-term effects aren't great. They can selectively decrease certain parts of your sleep cycle, like REM. We need REM sleep to dream, which is part of how we process our memories and emotions. And so it's just not great, right? We're meant to get all of these things for a reason. And so we just need to look at it from the angle of like, okay, what else is going on? And have you been properly assessed? Are you working with someone who really deeply understands sleep and all of the things that impact it? Are we looking at your hormone health? And then I will say, like, I have some patients who it's like they have treatment refractory insomnia and sleep difficulties, and no matter what we do or try, their sleep is very stubborn. And I always say, like, I wish we could just get inside their brain and figure out what was going on in there. But some people do need medication long term. And that's where we can work to find, like, okay, what's the lowest, most effective dose for you over time, right? And that can be something that makes a difference for those people.
We're going to interrupt this interview for just a second because we've got something we want to make sure that you know. If you're struggling with your health, with your fitness, if you don't know where to start or you know what to do and you're not doing it, we're here for you. And all you need to do to get our help is to reach out to Shawna and I at our email, sapodcast23@gmail.com. And we're happy to help and we will be in touch. Now back to the show.
Sleep is the magical elixir of life for myself. Like, I am emotionally dysregulated. There's just so much going on when I'm not getting sleep. So it's just such an important conversation.
It is. And if we can sidestep for a second, because one of the things we don't talk enough and recognize enough about sleep in the second half of our lifetime as well is sleep apnea. And as soon as I say that, I know people are like, well, I don't have that. But it's 1 in 4. 1 in 4 women have sleep apnea. The risk almost triples as we enter menopause, even after we control for age and BMI. Meaning, if we take weight and age out of the equation, just being in menopause increases your risk. Although we understand that, yes, age and increasing BMI. So if we have a higher adipose tissue percentage in our body, we're at increased risk. If you have a neck circumference, so if you actually measure your neck, and if that circumference is greater than 17 inches or 40 centimeters, you're at very high risk. If you have hypertension or high blood pressure, 50% of people with hypertension have sleep apnea.
Wow.
So when you start adding these things up and then recognize that women present differently. So we're not likely to present with snoring that keeps our husband up all night. That's not how we present. We are more likely to present with insomnia, treatment refractory insomnia, depression, morning headaches, dry mouth, persistent fatigue, excessive daytime sleepiness. So we don't always present as the classic, which means doctors don't often think of it, which means we don't send women for screening, which means we don't get diagnosed, which means we don't get treatment. You can see the picture I'm painting. So I catch sleep apnea in my practice all the time. To give you an example, I have a midlife woman who was coming to me because her energy was so low. And I'm like, okay, we're going to go through all these things. And one of the things is sleep apnea. She's like, I don't have that. I'm like, okay, it's just on my radar because it can be a thing. And so we checked all the other boxes like we've been talking about, and she's still feeling tired. And so I'm like, okay, you're going to go for your sleep study now? She's like, fine. She calls our office on the way home from the follow-up consult to review her results and says, they told me to call you and thank you because I have severe sleep apnea and I am having 57 apneic episodes per hour and holding my breath for up to 1 minute at a time. So apnea, it means just like decrease in oxygen. So basically you're working out in your sleep. So for different reasons, like our airway becomes compressed. This is where part of the weight gain has the role to play. And then we don't get proper oxygenation. So our cardiovascular system tries to compensate by increasing our heart rate and blood pressure to pump out the little oxygenated blood that it does have. It is like working out in your sleep. Of course, you can then understand you're going to wake up feeling exhausted and be really tired throughout the day. So if that sounds like you, if you've done all the blood work, if you're like, I'm getting enough protein, like I'm doing the things and I don't feel any different, please make sure your doctor has considered and or you consider doing a test for sleep apnea. You can now get at-home sleep tests.
Wow.
Game changer. Yep. And so it's just like 1 in 4, right? Like keep that statistic in mind because guaranteed the listeners can think of like your group of girlfriends is probably that big, which means at least one of you has it. And when we start talking about it, like today I had a patient and they didn't have it on their intake form, but I was like, have you been tested for sleep apnea? They have it. They just didn't put it on their form. And I was like, yeah.
What is the treatment for sleep apnea?
So the first line treatment is a CPAP, which is a continuous positive airway pressure. So basically we're like forcing air. So it's a mask. You can get different ones like a nasal cushion, they call it. So it's a smaller mask. If you don't tolerate those, there are mouth guards that will push your lower jaw forward and open your airway. But what is so cool is that it can be addressed through diet and lifestyle if we see adequate enough changes and improvement. So one really quick study I'll run through, it was in men, so we were kind of like having to borrow the research there if we're talking about applying it to women, but I think it would be valid. They put 89 Spanish men through an 8-week Mediterranean plus dietarian lifestyle. 37.5% of the participants had moderate sleep apnea at baseline, and the other 63 or 62.5% had severe sleep apnea. 8 weeks of intervention led to an average 7 kilogram weight loss, so about 15 pounds, and no one got worse. Most people who were moderate moved into the mild or remission. Most people who were severe moved into moderate, mild, or remission. Significant numbers, and remission meaning they no longer needed their CPAP.
Wow.
So again, we can think of that as like a bridging strategy. Do women or anybody like the idea of strapping a mask on their face and going to bed with that each night? No, but maybe it's going to be the thing that gives you the daytime energy so that now you can go and meal plan and prep and move your body and deal with all the things that you've been incapacitated to deal with in order to improve your metabolic health and then at least improve the severity of your sleep apnea, if not resolve it completely.
And one thing that I've been in this boat that I think that a lot of women don't think about, and maybe doctors don't, is also, do you sleep with someone who has sleep apnea? Because that's absolutely going to affect your sleep. And, figuring that out. Because I think, with our partner, we're like, we want to be together in the bed, sleeping together. But then if you can't sleep in that environment, then, that's a problem. And it's going to affect your energy level and those things if you're also sleeping next to someone who has sleep apnea.
You might need a sleep divorce so you don't get a real divorce.
I think that we need to talk more about that and like let people know that's okay. If that's what you need to get your sleep, like it's okay to sleep in a different room, get your rest. Yeah,
we stigmatize it, and it's not a reflection of your relationship per se.
Absolutely.
But
me and my husband we sleep in separate rooms. He's actually going to be getting he has severe sleep apnea, and he's tried the CPAP. He's done the mouth guard. He's actually going to be getting surgery. There's a surgical intervention now.
Yeah.
And he's not overweight.
He's not overweight, so the weight loss would not.
Yeah, that's not an option.
That would not be a solution for him. So
right.
Yeah. So yes, in the meantime. Yes, sleep divorce.
There you go.
To avoid
I will tell you, like for ladies out there listening, we didn't do that for a long time, and I suffered through that, and it has made a huge difference in how I feel and my energy level since we've had that sleep divorce. So I tell my clients all the time, like it's the best thing. Not, and again, like you said, it actually has made our relationship better, but not worse because. Yeah. Now I feel better, and now he's realizing how tired he is. It's definitely worth it to do things that will give us the sleep.
Yeah, whatever helps. Yeah.
Well, I think the big thing is to, as you started with at the beginning of the podcast, is bringing awareness and not just putting up with. We need to create solutions and not just drag ourselves through every day. Like we can make changes. So if you had a wish for our listeners today, what would it be?
My wish would be that you really step into this power that we're talking about. It's like step into and own your power of self-authorization and autonomy. And realize while you might not be able to control the outcome or control everything around you, you can control your actions and thoughts. And it starts with that. And once you step into that, you can make everything change and everything better. But persistence and consistency is always a part of that as well.
Alli?
My wish is that we will focus on sleep and make it a priority because it changes everything.
And I like the idea of examining the risk of doing nothing. Weigh that. And if you are not able to solve the health issue, the sleep issue, the weight issue, get help because it's out there. And the risk of doing nothing is likely higher than there's a definite cost to doing nothing. So consider that as well as potentially the cost of getting help because the benefits are there.
Thanks for listening. You'll find me, Alli, on Instagram at Alli Kerr Fitness.
And you'll find me, Shawna, on Instagram at Shawna Kaminski. Feel free to pop us a DM with questions and or feedback.
If you're enjoying the Girls Talk Healthy Aging podcast, please subscribe and share it with other health-minded women. Ratings and reviews are also much appreciated and help us get our message out to a larger audience.
Until next time, be healthy and be happy.